Ladies and gentlemen, at the outset, we express our gratitude to the Honorable Union Health Minister, Shri J.P. Nadda, for his leadership that has made these initiatives possible. Let's give a warm round of applause as I have the distinguished privilege in inviting Honorable Union Health Minister to kindly address us on this occasion, Mr. Jagat Prakash Nadda.
Minister of State, Shri Shripad Nayak ji, who is also having the independent charge of Ayush, my esteemed colleague, Shri Jitendra Singh ji, my colleague in the ministry also, having independent charge, Shri Dr. Henk Bekkedem, WHO representative of India, Shri B.P. Sharma ji, Secretary, Health and Family Welfare, Ministry of Health, Dr. Soumya Swaminathan, Secretary, Health Research, Government of India, Dr. Jagdish Prasad, Director General, Ministry of Health and Family Welfare, Shri C.K. Mishra ji, Additional Secretary and Mission Director of NHM, Dr. Arun Kumar Panda ji, our Additional Secretary, Health, Ministry of Health and Family Welfare, Shri K.B. Agrawal ji, senior officers of the ministry, development partners, experts in the field of health, NGOs, representatives of civil society, representatives of media, print media and electronic media, and ladies and gentlemen. It is indeed a matter of great happiness for me, and it gives me immense pleasure to welcome all of you on the World's Health Day. In fact, the Ministry of Health and Family Welfare has been celebrating this day of Health Day as a Health Week. 4 days before, we had a very intensive interaction with the stakeholders on e-health authority, and we came out with very concrete proposals how that e-health authority can be established. 3 days before, we had a nationwide summit on family planning, and especially giving due consideration to reproductive and child health care, on continuum care, and a life cycle approach. And very valuable suggestions came today. We also disseminated and we started many digital initiatives to see to it that our ASHA workers is strengthened and enabled, and our A&M workers are also enabled to rightly trace and see the health of the pregnant mother and later the health of the baby delivered. So new initiatives have taken place, and today also a series of initiatives which the health department has taken has been witnessed by all of you. So I welcome all of you, and I wish you all for a very warm greetings on the World's Health Day. It is also a day of introspection. It is also a day for planning. It is also a day for strategizing and re-strategizing. And it is also a day to rededicate ourselves for the health care in the country. I think if the theme is rightly decided by WHO, and I must thank WHO also for coming out with the Ministry of Health and Family Welfare to organize this occasion. The theme has been the diabetes. Today only, in one of the world's most acclaimed health journal, India is one of the top 3 countries as far as the diabetes is concerned has been published. So we know the problem, and we know the potential of the problem, and we also have to strategize accordingly. We also know that diabetes is not itself a disease in itself alone. It is an invitation to other diseases also. And so comorbidities wherever it is concerned, diabetes is one of the basic reasons for it. If we talk about cardiovascular diseases, if we talk about hypertension, if we talk about other complications taking place, and now also for tuberculosis and for mental health also. So really it's a disease which needs to be addressed, and it has to be addressed in the right perspective. I am happy today to invite Dr. Jitendra Singh Ji, not only as a Minister of State, independent charge, but as an endocrinologist also. We got the views from him, who has got a rich experience of 3 decades serving as an endocrinologist. So he came out with very vivid ideas also, and he came out about the gaps which are there in our treatment processes. I can assure Jitendra Singh Ji that whatever you have said, we will try to fill those gaps, and we will do it accordingly to go ahead and see to it that diabetes is addressed in the right perspective. We have done good in MDGs, and now MDGs have paved way for SDGs. We have learned from MDGs also, and so we have to better perform as far as the SDGs are concerned. And with all your support and with all the active support of stakeholders, we will be doing the best as far as the SDGs are concerned. We know that in the target 13, which talks about the NCD and which also includes diabetes, has to be addressed. But dear friends, we all know, मुझसे कई बार जब लोग पूछते हैं तो हम तो कहते हैं कि we are on the receiving end. समस्याएं कहीं और होती हैं, कल्बिनेट होकर के हमारे पास आती हैं. So we are also always on the receiving end. We have to work with an intersectoral cooperation with our other departments. And we have to see to it that if we talk about diabetes, obesity, lifestyle, less physical activity, और मैं कई बार हंसते हंसते बोलता हूँ, moving around Connaught Place late nights, loitering around Nerulas or other places, having food at late night, and then also having pan and other things also. And that is why I'm happy that with WHO we are coming out for an intersectoral strategy, and approximately 40 departments have been brought into the fold to see to it that these 40 departments with the health department have to actively work and see that how do we strategize and see to reduce the NCDs. Dr. Soumya Swaminathan was talking, and then C.K. Mishra ji was also talking about the preventive part and the curative part. I want to only suggest is that we have to take it in a way where we take care of the curative part, but at the same time we have to be very, very aggressive on the preventive and promotive part. And we have to catch them young. School education should become our focus area. बाद में तो everybody says मेरा बुद्धि नहीं चलती है जब तक मैं थोड़ा लेता नहीं हूँ. कोई बोलता है मेरी पाचन शक्ति थोड़ी सी गड़बड़ हो जाती है. तो ये this is an after effect. You see, they come out with reasons because they are captive now. The lifestyle has made them a captive. We have to see to it that we catch them young so that they become captive of healthy lifestyle and they go in that direction. And that is why we have to re-strategize accordingly. इसलिए मैं कई बार इस बात पर जोर देता हूँ. I have been interacting with young students a lot. उसको पता नहीं है कि सॉफ्ट ड्रिंक्स में क्या पड़ा हुआ है, कितने sachets of sugar है. But when you educate them, they themselves go for other juices. If you tell them something, अब मुझे दुख होता है, मैं फील्ड में रहने वाला आदमी हूँ, I see स्कूल के बाहर ही सबसे ज़्यादा गुटखे बेचते हैं. तो वी हैव टू बी वेरी एग्रेसिव ऑन इट. और एक बार बच्चे को अगर समझा दिया तो फैमिली समझ जाती है, वो बच्चे बाप को भी समझा देता है. इस बात को हमको समझना चाहिए. इसलिए दिस इज माय एंड वी आर वर्किंग ऑन इट. वी आर वेरी एग्रेसिव ऑन इट एंड वी वुड लाइक टू गो फॉरवर्ड. We are thankful to Honorable Prime Minister because in the budget he has given us the opportunity to address the kidney problem, and it's a very innovative idea has been propagated and proposed. We are going very fast on it. Today we have come out with the PPP guidelines, public-private partnership guidelines, where every district hospital will have the dialysis facilities, and we will make them accessible and affordable. And we will give them with the PPP model, we are trying to work and see to it. And this is going to bring really a change. The same way today, the documents released, the WHO Global Report on Diabetes, the Technical Report of India, and the ICMR India Diabetes Study Phase 1, and also the RSSDI. They have also come out and done a very good job. I must thank them, and they have accepted my invitation to be here. I really welcome them, and I accept your invitation, especially Dr. Jitendra Singh and all his esteemed colleagues. So these are the things which have come forward. As far as the end stage of renal disease is concerned, out-of-pocket expenditure, as Shri K. Mishra ji and Sharma ji, हमारे Secretary Saab was talking about, out-of-pocket expenditure को reduce करने के लिए we have to see to it that we address this issue. And that is why when I thank my Prime Minister, our Prime Minister, we also assure that we will be coming out in a very, where we see to it that all logistics are met in the right perspective, and this program becomes a successful program. Today we have also launched the Swachh Bharat application. We have also launched the Anmol, that is the ANM online. I think this is going to be this has been a very revolutionary step. Making them enabled with mobile apps and with giving them the tablets. We are also giving each NM a tablet where she is going to keep online all the registrations. And even when she records offline, the moment the internet she comes into the internet connection, it gets connected, and all the document or the statistics or the data which she has fed will come to the main server. So this is a very revolutionary step, and I think this is going to really give a good instrument to take care at the grassroots level of the health of the children, of the mother, and see to it that the health programs go forward in the right direction. As far as the E-Rakt Kosh is concerned, we all know, we have been always witnessing when there is a trauma, the family members run from one place to another. They don't know where to get the blood. They do not know where that blood group is going to be there and whether they are going to get the blood or not. But yes, this online E-Rakt Kosh is going to help and tell them where this blood is available and how they can get that blood. The same way, it will also have the registration of the persons with those blood groups in the radius where he needs the blood. So he can also contact them and see to it that the blood is given to the patient. But here, we all stakeholders will have to take one thing into consideration, and we'll have to work on it to see to it that we keep the real-time data in it. And for that, we have to sensitize and we have to involve everybody and see to it that the systems work and they are really in place. So updating is very important. हम लोग बना देते हैं मोबाइल apps बना देते हैं सब कुछ कर देते हैं, but when we start using it, we find that it is not updated. And when it is not updated, it is of no use. So we have to keep them the real-time data information into it, and how do we go forward is something which is needed. I have requested and I have suggested Secretary Saab that continuous sensitization and continuous training on this aspect should be there so that the digital issue is a digital facility can be availed by the people of the country. We have come with a very innovative idea of addressing the vector-borne disease. Today we have brought the do's and don'ts and also to see to it that how dengue can be addressed, this issue can be addressed. We all know that Aedes mosquito, which is also linked to Zika virus also. It has to be addressed in the right perspective. And if it has to be addressed, we have to see to it that we all know and sensitize people about dengue. As Honorable Prime Minister was just now in the message saying that it is avoidable, but at the same time, it becomes very dangerous also. And it is not only to developing countries. It is not related only to developing countries. This virus and this mosquito is prevalent in all parts of the world. And so it's very dangerous, and we have to see to it that we strategize accordingly. In this year, according to our strategy, we are going in an aggressive manner to see to it that preventive part is taken care as far as dengue is concerned. Last year, we witnessed in Delhi, although we had a very exhaustive training programs with municipal corporation members and other representatives, but still it didn't work as it had to work. And so the patient number was on a high, it was pretty high. This time we want to see to it, and in time we have come out with that digital program, and in coming times we'll also see to it that we have exhaustive training and interactions with the local representatives and see that how we can address. The same way, we have also tried to see that vaccine preventable diseases are taken care. Mission Indradhanush has been really successful. Routine immunization used to take place by 1% every year. The increase was only by 1%. And today, with confidence, I can say that the increase in vaccination in 2015 has been in between 6 to 7%. So today, we are also launching the third phase, where we are taking 216 districts in Mission Indradhanush, other than the routine immunization, and we are also increasing the vaccination, the basket, from 7 to 11, where we are including rotavirus, where we are including measles, rubella, JE adults, and IPV. So that we have done, and we are going forward in that direction. Friends, I must also thank Honorable Prime Minister for giving us the vision of a holistic health approach. Today is the day when we should think about it. We have been working for long in silos. Allopathy does not recognize homeopathy, homeopathy does not recognize allopathy, allopathy does not recognize Ayurveda. And we were working in different directions, and we say because we don't know, it's not documented with us, so we have got nothing to say about it. But now we have started working in synergy. I'm happy that all tertiary care centers, the AIMS, have got an Ayush block. We have also worked last year in diabetes, where approximately, I don't know the exact number, but some 26,000 patients who were doing yoga and who were practicing yoga, and we gave them the logistic support of their blood tests and tried to see to it that how yoga can help in reducing the diabetes and how it can be helpful to the diabetic patients. So such type of interactions are needed, and such type of innovative steps should be taken care. World Yoga Day we introduced last year, and it has become a really a successful program. We need to go ahead in that direction. As far as the assurance part and the insurance part is concerned, the health department is coming out with a very exhaustive scheme. As far as the assurance is concerned, we are trying to see to it that till the CHC district hospital level, we will be giving free diagnostic and drug facilities in the to the state governments. And as far as the insurance part is concerned, we are planning to give at least 8 crore families, which comes to the 1/3 of the Indian population, who are economically weaker sections, to bring them into the insurance fold, where we are going to give them, on a floater basis of a family, a coverage of 1 lakh rupee per year and 30,000 for each individual who happens to be a senior citizen. So 1,30,000, there are 2 senior citizens, 1,60,000 health coverage per year we are trying to introduce. So this is one way to reduce the out-of-pocket expenditure of the individual family, and this is how we are going forward. On World Health Day, I would like to really thank my health experts, my researchers, the paramedics, the doctors, the nurses, the ASHAs, the ANMs, who have been doing very good job. And as Health Secretary was saying, that with all our limitations, C.K. Mishra ji was also saying, with all our limitations, India is trying to do our best. We are all field workers. We know in what diversities we work. We know in what difficult conditions we work. And we also know, हमसे कोई बात करता है तो हम कहते हैं we are not retailers, we work in wholesale. The quantum of the population, the size of the population, the size of the problem, and how do we address that has to be taken, really has to be understood. And we are doing in that perspective. I am very hopeful and I am very happy to share with you that in spite of all problems, we are going ahead in an aggressive manner to address these health issues. And in coming times, it will be Swachh Bharat and Swasth Bharat with all your support. Thank you very much for giving me a chance.